Hello, everybody. I'm Lori Jovest, and I do social media marketing for Mile High Denture and Implant Center. And I'm here today with Dr. Michael Woodbeck, who is going to talk to us about the patient experience with full arch dental implants. It's different than dentures. It might be something you don't know much about. So we want to dig deep a little bit today. Hi, Dr. Woodbeck. Can you tell us a little bit about yourself?
Hi, I'm Dr. Woodbeck. I'm the oral surgeon that's at Mahi Denture and Implant Centers. So I'm the one that does pretty much all of the surgeries for patients that come and see us. And then I also work with a bunch of restorative doctors who are really great at making people look really good.
Awesome. So you're the man. All right. So the first step, we always, when people ask us on social media, what's the first step or how do I know how much it's going to cost me, that kind of thing, we always recommend that they go right to a free consultation where you're going to figure out what they need and help them determine the best path for them as well as how to fund that path. Can you tell us a little bit about what's involved in that first consultation?
Yeah, so every patient is a little bit different and has different needs. And so we like to be able to have people come in, get a three-dimensional scan of their mouth and teeth and everything, and then meet with one of our treatment coordinators as well as one of our restorative doctors who kind of go through and make sure that you get a treatment plan that meets your needs and ensures that it's something that can achieve the goals that you're looking for, so that'll entitle going through what the treatment looks like, what the costs look like, and then one of our treatment coordinators can kind of help out with the financing side as well too, if there's a need on that side as well too, and then give individual costs for folks as well.
Wonderful. So now, once they've gone through that free consultation, they figured out, how they're going to fund it. They're ready to go. What's involved in pre-treatment? What does that mean?
Yeah. So once we have a treatment plan and a game plan to move forward, then there's some taking some molds of current mouth situation in order to kind of plan for the teeth that'll go in on the day of surgery, as well as talking about what surgery looks like, what to expect in the immediate time after surgery in that postoperative period, what kind of foods that you can expect to be eating, and then also just going through the timeline of the appointments after surgery and when you'll be kind of finished with us and have like those permanent teeth, because usually we
Mhm.
do some immediate temporary teeth that are on the implants that are in the mouth, but we like to make sure that you get the zirconia, the really strong teeth, about 4 or 5 months down the road once everything is really well healed and we can make everything perfect at that time.
Wonderful. So, do most patients need extractions? Is that common?
Yeah, it's very common. So a lot of folks that come to us that either, have painful teeth, broken down teeth, things that just can't really be repaired, or in some cases would just actually be more work to try and repair the existing teeth versus
Yeah.
maybe extracting some teeth and placing some implants and then having some teeth built off of there.
Plus, from what I understand, once they are placed, they're permanent. Where if you're trying to fix existing teeth, they're not, right?
Yeah,
They may not
that's
be.
that can be very true. And the implants, once they're in place, as long as they're taken care of, they should be able to last a very, very long time.
Wonderful. So tell us a little bit about how these implants are created. I know some people like, oh, my mouth is small. Dentists have always told me my mouth is small, or, that people are nervous that they're going to be too big or, not fit quite right. Um, are they custom, and how do you go about creating that custom implant?
Yeah. So the implant is the titanium screw that goes into the bone, and then we build some teeth off of those, and the teeth are all custom to each individual patient. So we have an on-site lab technician who is using some wax to kind of build these custom teeth there, so that they fit 100% to each individual patient. It's not a small, medium, large type of situation. It's
Right.
everything is custom made for each person's mouth because everyone is a little bit different.
Now I hear you can also pick Hollywood white. Am I correct?
Yeah, sure. Some people like them to, be
Glow.
seen in the dark, but we can do more natural colors as well too, or the super super white as well too.
Awesome. So you have one here that you're going to show us, right, today?
Yeah.
What
So
does it look like? Okay.
yeah. So on this model, there is a bit of a clear area where you can see those gray areas there, and those are the dental implants that are in the bone. And then the teeth, what we like to call the prosthesis, are attached to those implants. And basically, there's little screw holes in the
Oh,
teeth. And basically, I
got
tell
it.
people it's kind of like working on a car. Once the dental implants, which are the titanium screws, are in the bone, we can kind of connect things to there with a tiny
Nice.
little torque wrench and a tiny little screwdriver. And once they're in place, it's kind of like working on a car. You don't need any more needles to numb you up or anything once they're in place. It's just screwing things on and off of there.
Nice. Nice. So what if somebody gets their first set and they're not perfectly happy with how they look? Then what happens?
Yeah, so we like to address that in doing some fittings kind of where we can take the setup that the lab technician has made and we can put it on those implants with those screws and just allow people to see that, see the color, the shape, and then be involved in making some of those changes of like, I don't like how this looks, or this color is not great for me. And kind of going through that to be able to like tweak things a little bit. And then usually the doctor that's kind of making the teeth along with the lab technician can kind of look at that and hear some of the feedback there and make some adjustments and do another kind of fitting before we get to processing another set.
Okay, got the final set, right?
Yeah,
So
the
the
final.
implants are placed. Now, what does the first set is placed right after surgery, but then what's the recovery look like?
Yeah. So I tell most people that, by about a week after surgery, you should feel pretty darn good. You got some swelling and discomfort for 3, 4 days, and then it gets a lot better from there. And then we just ask people to kind of rinse their mouth with some salt water, take their pain medication regularly, take their antibiotics regularly, and then by the time we get out to about a week after surgery, most people feel really good. The discomfort subsided, the swelling subsiding, and they're functioning fairly well.
So if somebody says that they're afraid because maybe they have a fear of dentists or they're just really afraid of it being painful, what do you tell them?
Yeah. So the nice part is that when anybody deals with me, they're probably asleep. So we put every
That's
single
good. That's
person
a
to
good
sleep
thing.
when we're doing surgery. Yeah, no,
Yeah,
I'm at my best when people don't remember me. So
it's
yeah,
awesome. I love
yeah,
it. And then if
yes.
there's any after pain, is it usually, tolerable or taken care of by over the counter?
Yeah, mostly over the counter. We do some prescription strength medication for the first couple of days, and then kind of tailor that based on each person. And I give everybody my cell phone number the evening that we do surgery. So then if they're having some discomfort, then we'll kind of tailor some of the pain medication
See,
for
I
them.
think that's amazing. A surgeon that gives you his cell phone number. That is amazing. That is service. I mean, that is really helping patients. That's got to be comforting to know that they'll be able to reach you if they need you, because that's not always the case when you have surgery.
Yeah.
So I know patients, once they've had the final placed and they go on about their life, they come in every so often for maintenance appointments. What does that look like?
Yeah, so usually people come in every 6 months to a year just to get a cleaning around the implants, make sure that there's nothing getting trapped under there. And then at some of those appointments, we do remove the teeth off of the implants by unscrewing it, just so we can make sure that everything's clean around there and clean it out really well, and then place it back on. Get some X-rays every couple of years or every year just to make sure there's no surprises under the hood.
Got it. Now, as a patient, are you still brush your teeth every day, right? Like you normally would?
Yeah,
Anything
the
special you need
biggest
to do there?
the water pick becomes everybody's greatest friend. Is that there's like a little area between the gums and your and the teeth or the prosthesis where you can kind of
Oh,
spray in there with a water pick. So become great friends with a water pick.
got it. Sounds like it's a nice, easy tool, though. That doesn't sound scary to me. So that's
No.
good. So when patients, let's say a patient comes in and it's been 6 months and they see you, they see the team for the first time and they're so excited. What do they usually say? What are their biggest um, happy points? What are they really
Yeah.
happy about?
A lot of people say they wish they did it earlier, actually. A lot of
Yeah,
times is that they were really worried about things and that they didn't really need to be as worried about it. A lot of people say it wasn't as bad as I thought it was going to be in terms of like
good.
recovery, but then they're back to eating the foods that they really wanted to eat because a lot of people come to us and they're eating these softer foods. They can't eat a steak. They can't eat the things that they really want to. They can't go out
Yeah,
to restaurants and eat like they wanted, and all of a sudden they're able to kind of eat whatever they want at that point in time. And also, a lot of people get this increased confidence as well too of like smiling in social situations. They're able to kind of get back out there. We get quite a few folks that are just like, I want to be out in social settings, but I'm so self-conscious of what I have going on, and I just feel a little trapped. And then they're
yeah.
getting back out there and living their life and really excited about it.
We hear a lot of new jobs, and we
Yeah,
hear a lot of new boyfriends and girlfriends. Dating life is more successful,
yeah,
and just the overall confidence and ability to go out to dinner and really enjoy it. To even eat an apple, I think that's so interesting because those of us who don't have dental issues don't even think about that, and it's a real issue for the patient if they have problems with dentures or teeth that are painful or don't support their health. So is there a lifetime guarantee on these implants? The 4 on 4, they call them 4 on 4, right? Because there's 4 implants on the top and 4 on the bottom. Is that what that is?
yeah. Generally, there's
All
at
on
least
4.
four, yeah, at least four implants in each upper jaw, lower jaw, and then those. And we service things. Generally, there's like a 5-year warranty on the teeth themselves from the manufacturer, and then we service things. If you're taking care of things, then we're going to take care of you as well too. So that's really the biggest thing is that it's kind
Yeah.
of a partnership. As long as we're both taking care of things, then we'll make it right.
Yeah. So that's where we count on the patients to follow directions, come in for their maintenance appointments, and do what needs to be done to make sure they're caring for them. So, yeah, that makes a lot of sense. So, a couple last questions here. How custom are custom implants?
Yeah, it's like each individual person gets a different treatment plan and different shaped teeth, and
So,
yeah,
could I
it's
bring in
each
my
individual person
picture
gets a
of my teeth before and say, make me look like I did when I was 20? And you could
yeah,
actually use that as reference?
yeah, yeah,
That's
for sure.
awesome. Has anybody ever said they
Yeah,
would like Brad Pitt smile?
I don't remember, but yeah,
No,
I
not
don't
any
know.
particular celebrity. Okay. All
No,
right.
I don't.
All right. Sounds good. Well, is there anything else you'd like patients to know before we wrap up today?
I don't know. I think just that the best way to kind of figure out what you need is to kind of come and see us so that we can kind
Yeah.
of tailor a treatment plan. And there's no harm in coming and getting a scan and kind of working towards what a possible treatment plan would
And
look
there's
like.
no obligation to that first appointment at all. Go to milehighdentalcenters.com. There is a form and there's also a phone number. Feel free to call in or put your information in that form, and someone from the practice will call you and answer any questions and set up that first consult. So that is all we have for today. Thank you so much for being here, Dr. Woodbeck. We really appreciate it. We'll be back in about another month with another Facebook Live event. So if you have any questions, pop over to our Facebook page, leave us a message, send us a private message or leave us a message there, and we will add it to the list of things that we'll talk about with another doctor. Might be Dr. Woodbeck, might not, but whoever it is, we'll be able to answer any questions you have. So thank you for joining us today, Dr. Woodbeck, and everyone in our audience, and we'll see you again soon.
Perfect. Hopefully, it's one of the